storage. Because insulin's work is, it is an anabolic hormone. Its only work is push all the glucose out of the seam. And body feels there is no glucose and we feel hungry again and again. I still remember once upon a time we used to tell, if you feel hungry or healthy, your body is working well. But now that is not the case. If you are feeling hungry more frequently, probably you are insulin resistant. Your insulin is not working, or it is pushing all the glucose into the impair the liver function, impair the mitochondria, which is the heart of any living cell. So hunger, food intake, feeding our fatty liver. So this should be, the actual peak should be like the blue line. Within that range, if it's maintained, we don't feel hungry so often. We eat about increased risk of diabetes or cardiovascular disease and stroke. All of you know very follows, which is also followed by insulin secretion. So this has come from long-term cohort studies, cross-sectional studies. Also they showed that sugar intake and highly refined carb intake can impair cognitive. Gut microbiota, because while sugar feeds the unhealthy bacteria. So intestinal inflammation, increased permeability, impaired breaking down of dietary toxins, carcinogen.
Hi, I'm Dr. Rajendran. I'm a cardiologist from Coimbatore. I practice preventive medicine these days. I have completed cardiology 29 years ago. Things have changed a lot from then. Now, earlier people used to come with heart attack in 50s and 60s. Now the parents have started bringing their sons and daughters at 20s and 30s. So it's time we change. It's true that in the last few decades, scientific advances have taken a leap. But still, I don't think that has brought down the death rate or the prevalence of heart disease. So the one thing which can change the maximum amount in bringing down the cardiovascular mortality is the diet, and that is what PAN focuses on, and I am advisor to PAN here. So we hope to make a change by this meeting by educating the physicians about the dietary changes which will help not only in cardiovascular disease but in all other non-communicable diseases, and make the planet a better one for us to live. Thank you.
Everyone, I am Dr. Pratima Kini, and I am the chairperson of the Bangalore chapter of the Physicians Association for Nutrition. So we are having a second CME here in Bangalore, and it is a proud moment for us because we have around 300 doctors who have registered. I mean, we had more than that, and we have so many people who have come and are eagerly listening because we need to know a lot more about nutrition. And Hippocrates had said that all diseases begin in the gut, and we are seeing that is what is happening right now. So if we know about what we are putting into our mouths, and that is what we call food as nutrition as doctors, if we know more about it, we can definitely treat a lot more disorders. But 56.5% of the mortality in India is because of what we call as these non-communicable disorders. And imagine if those things can be treated, people can be eating better and definitely have better lifestyles and health. Not only will our health improve, the health of the planet, and we're going to have a better future for our children. Thank you.
I'm Dr. Regina Shahid. I am the medical director for 30th Physicians Association for Nutrition India, and we have decentralized our operations. We have a Bangalore branch right now. We have a group of chairpersons and directors, advisors who will be handling the Bangalore-based mission advancement operations here under the guidance of the head office. So PAN, or Physicians Association for Nutrition India, is actually training doctors, engaging them with us, and taking this movement, nutrition in medicine, forward. This means when you go to a physician, as a patient, when you're going with a high cholesterol, the doctor will be prescribing medications. Here, once we train our doctors, they will be doing nutrition and lifestyle intervention as the first line of management. That too predominantly focused on a plant-based diet. Eating more plants, which means more vegetables, more fruits, more nuts, seeds, legumes, whole grains. That's what we are going to do. So in our curriculum as doctors, we haven't learned nutrition in detail. So these kind of continuing medical education programs are the arena whereby we can actually train our doctors. Once they train, you will have better health care. You will not have this kind of only sick care anymore. You will be able to get into a better health in terms of your overall health, preventing diseases, productivity, maybe better sleep, multiple of these things. That's what we are doing, and I would like to introduce my team. Dr. Pratima, she is the chairperson of the Bangalore chapter. Thank you.
I'm a practicing surgeon, a breast surgeon, and I run a center called Prameya, which is a Center for Preventive and Supportive Care. And I'm part of PAN as a co-chair of the Bangalore chapter. And it is a very important movement that is happening, because we see, as a surgeon and as a breast cancer surgeon, I see a lot of patients where diet plays a very, very pivotal role in the management and prevention of cancer. So it is a very important conference that is happening here, bringing together the medical fraternity in the hope that we will be able to make a demonstrable change in the near future in the way we look at diet. We are elevating the role of diet in managing and preventing disease, especially cancer.
Thank you.